In the United States today, around 500 people are infected by the disease sarcoidosis. This is a very rare disease, and not very many people know about this disease, including the causes, symptoms, and treatment for the disease. Both of my parents suffer from this disease. My father is currently in stage 3, and my mother is currently in stage 1. This is not a common disease, and yet a large number of people are affected by this disease. Doctors also do not really know the cause of this disease. Autoimmune diseases, which sarcoidosis is one, arise from an overactive immune response of the body against substances and tissues normally present in the body. There are many different signs and symptoms to sarcoidosis. While there is many signs and symptoms to this disease, there is also many forms of treatment for this disease. As I had stated before, sarcoidosis is an autoimmune disease that is characterized by non-casting granulomas. This means that there are small inflammatory nodules in the body somewhere. It causes heightened immunity, which means that a person's immune system, which normally protects the body from infection and disease, overreacts, resulting in damage to the body's own tissues. The classic feature of sarcoidosis is the formation of granulomas, microscopic clumps of inflammatory cells that group together and look like granules, hence the name. When too many of these clumps they form in an organ, they can interfere with how that organ functions. In people in the United States, sarcoidosis most commonly targets the lungs, lymph nodes, but the disease can and usually does affect other organs too, including the skin, eyes, liver, sinuses, kidneys, heart, the muscles and bones, and the brain and nervous system. No one knows exactly what causes sarcoidosis, but it is probably due to a combination of factors. Some research suggests that bacteria, viruses, or chemicals might trigger the disease. Although such triggers might not bother most people, it is possible that someone with the right genetic predisposition, they provoke the immune system to develop the inflammatory associated with sarcoidosis. The fact that a person is more likely to develop the disease if someone in his or her close family has the disease strongly suggests that genetics plays a role. Researchers have not yet discovered the gene for sarcoidosis yet, but it seems likely that more than one gene is involved. Sarcoidosis is a medical name, but this disease is also known as sarcoid, or Benson-Brock. There are many signs and symptoms for this disease. One of the first signs of sarcoidosis is cardiac sarcoidosis. Although cardiac involvement is present in 20 to 30% of patients with sarcoidosis, only about 5% of patients with systemic sarcoidosis are symptomatic. The presentation of cardiac sarcoidosis can range from ischemic conduction abnormalities to fatal ventricular arrhythmia. Myocardial sarcoidosis can be a rare cause of sudden cardiac death. The next symptom of sarcoidosis is sarcoidosis in the nervous system. The combination of anterior features, cranial nerve paralysis, and fever is called evaporative fever and is associated with hermaphrodite Malmstrom syndrome. The central nervous system is involved in fewer than 1% of patients with sarcoidosis. There is usually granulomatous involvement of the basal meninges that substantially affects the cranial nerve. Myelopathy may be the initial clinical presentation of intramedullary neurosarcoidosis. Another symptom in sarcoidosis is the lungs. The lungs are infected in more than 9% of patients with sarcoidosis. A cough does not go away. Shortness of breath, particularly with exertion and chest pain, occur most frequently with the pulmonary form of this disease. The last symptom of sarcoidosis is the skin. 1 in 4 of patients will have skin involvement. Painful or red raised bumps on the legs or arms, discoloration of the neck, chest, cheeks, limbs, and ears, or small brownish and painless skin patches are symptoms of the form of the disease. This is a picture of what the skin disease looks like from sarcoidosis. Some of the other symptoms and signs are fatigue, unchanged by sleep, lack of energy, weight loss, aches and pains, arthritis, dry eyes, swelling of the knees, blurry vision, shortness of breath, a dry hacking cough, or skin lesions. There are around 500 people in the United States that have suffered from this disease. The majority of these people suffering from this disease are African Americans. Though there are a lot of signs and symptoms for this disease, there is also treatment for this disease. In some cases, no treatment is needed for this disease, as my mother requires this. but for some patients, intense treatment is required, especially if organs like the lungs, eyes, heart, and central nervous system are affected. Treatment is generally due to control symptoms or to improve the function of organs affected by the disease. One of the first treatments is therapy. This therapy means prednisone. This has been the common treatment for many years now. In some patients, this treatment can slow or reverse the cause of the disease, but other patients do not respond to steroid therapy. The use of corticosteroids in mild disease is controversial because, in many cases, the disease remits spontaneously. Another way to treat sarcoidosis is with steroids. Doctors generally use the steroid drug prednisone to treat sarcoidosis. Steroids are powerful anti-inflammatory drugs that mimic the effects of hormones produced by your adrenal gland. They're not the same as anabolic steroids used by some athletes to increase strength and muscle mass. To wrap things up, this is a disease that not very many people know about, and yet it affects hundreds of people, and doctors do not know the cause of it. This is an autoimmune disease that affects different organs in the body, and there are many signs and symptoms that go along with the disease. But while this is a bad disease to have, there's also treatment for this disease. People in your family could have this disease, and yet you don't know about it. Now you're informed about this disease, and you even know the basic information.